Hi there and welcome to my YouTube channel. I'm Dr. Manish Shah. I am a board-certified plastic surgeon here in Denver, Colorado, and I specialize in both rhinoplasty and management of the aging face. This video today is going to be talking about my technique in High SMAS Deep Plane facelifting surgery, and a little bit about the background anatomy that you need to understand so you can understand why I do this operation. And I'll show a little bit of content so you can see the results of this amazing operation. So stay tuned. The video is going to be a little bit long, but I hope you stay around. And if you have any questions or comments, please put them down below in the comment section. So enjoy. But before I get started, I just wanted to give you a little bit about my background. I graduated from the University of Pennsylvania with a bioengineering degree. That was 30 years ago, and to this day I still use what I learned there when I perform rhinoplasty surgery and surgery of the aging face. After I finished college, I went to some of the best medical schools, residency programs, and plastic surgery fellowships in the country. I ended up in New York City in 2004 for the aesthetic surgery fellowship at the Manhattan Eye, Ear, and Throat Hospital. That training basically set the groundwork for what I do today. I learned from some of the best facelift surgeons in the world in the hands of Dr. Sherelle Aston and Dr. Daniel Baker. Since then, I've spent a tremendous amount of time both performing surgery and continuing to upskill myself. At this point, I think I've done well over 3,000 face and neck lifts, and I continue to train with some of the world's best facial plastic surgeons and facelift surgeons, folks like Dr. Mike Nyack and Dr. Andrew Giacono, along with Dr. Tim Martin and the MAFAC group headed by Dr. Brian Mendelsohn out of Australia. I think staying on top of this operation and being able to provide continually improving outcomes for patients is really the best thing I can offer. So let's move on to the video and let's talk about the anatomy you need to understand. So in this slide, what you're going to notice is that on the top where I have that small CT scan of a 4-month-old face, what you're noticing is that the skull or the cranial skull is really big, but the facial structures and the facial support is relatively small. So in a baby, that gives you chubby cheeks and big jowls. Now in the second slide down, what you'll notice is that's basically the CT scan of somebody who's a young to middle adult, somewhere between 25 and 40 years old. In that picture, you see a much more balanced amount of cranial bone and then facial bone. What's happening there is basically the face is grown out and is stretching out all the tissues to give you a much more ideal 1-to-1 surface area to volume ratio that I think is the hallmark of a young face. And then in the third CT scan picture, that is the picture of somebody who's over 70 years old. And what you notice again is big skull, and then a lot of the facial structures have retruded, shrunken, and that is what's causing our tissues to hang over these sort of atretic or shrinking bone areas. And notice the 4-month-old skull looks a lot like the 70-year-old skull. I have to credit Dr. Val Lambros out of Newport Beach with this idea of shrinking skull volumes being sort of the base for why faces age. It's more complicated than that, but this is a really good way to understand it. So in this slide, I show a video of a young pilot who's probably in her early 30s. And what happens when you put a short burst of high G-force in her, sort of on her body essentially. And you can watch how she goes from being young and lovely to looking like she's 40 years older with her eyes sunken in, and her cheeks dropping, and her jowls forming. It's extraordinary to see how gravity works. Well, gravity doesn't work that quickly in reality, but what it does is it shows you that as we age, our structures start to sag, and when you combine that with volume loss in the bone, we start seeing these empty spaces like the empty lower lids and the deep nasolabial folds and the jowling and the hanging neck. So in the next slides, I'm going to show you the anatomy that basically explains this process. So check it out.
Pull back on the stick. You're on top, breathe. Settle in, abs out, breathe. Legs tight, left arm out, breathe. Squeeze your knees together, breathe. Butt tighter, abs out, breathe. Head back, legs tight, breathe. Knees together, terminate, let go stick, hold your strain, and go ahead, relax.
Whew. So in this slide, what you're seeing is the 3D cross-section, or 2D cross-section, I should say, of the facial structures, with the outside being the surface of the skin that you see in the mirror, and that deep white line being what they call the periosteal covering over the bone. And so the SMAS layer happens to be the fourth layer, and SMAS stands for submuscularis aponeurotic space. And it's a nice free space that we go into that allows us to grab the overlying tissues and lift them up nicely during surgery. So in the Roman numeral 1, or first little slide, what you're noticing is basically where you cut to do a quote-unquote skin-only facelift. Now, a skin-only facelift essentially is an old technique. It's fallen out of favor a long time ago because essentially it just pulls on skin and you get a little bit of improvement and you get a lot of scarring problems over the long term. In the second picture is an operation that is what I used to do that I've now hybridized. But essentially, it's what you call the sub-SMAS operation, where you do an operation where you cut the incision in front of the ears, you lift up the skin to a certain amount of space, and then you make a cut into the SMAS and go down. So it's basically delamination or lifting of the skin, and then disconnection of the SMAS to whatever extent you feel comfortable as a surgeon, typically to the osteocutaneous ligaments and past, and then you elevate the SMAS in one direction and you lay the skin back in another direction. It's a great operation the older you become because it allows for more variability in the face without getting that pulled, strained, swept look to the face. In the third variant on there, you see the plane for what they call deep plane surgery. Now, deep plane surgery traditionally involves a little bit of skin lifting and then essentially what they call en bloc or composite lifting of both the skin and the muscle section or the SMAS in one unit. And it allows for a very powerful lift to the face and basically cheeks, nasolabial fold, and jowl area. But it has a certain amount of subcutaneous or under the skin dissection, which can have some issues in terms of healing, skin coloration changes, etc. But it's a lovely operation, and it is pretty powerful. It's probably best for people under 55, just from the way the vectors lift for the SMAS. The older you become, a high SMAS operation is a much more powerful operation. And then the last operation basically is my old operation that I've done for years on end, and that's basically a skin incision to lift up the skin with wide undermining. And then instead of cutting the SMAS, I use very finely placed sutures that basically tighten the SMAS underneath, like you would imbricate it or you would purse string it, things like that, to basically tighten up the skin like this, and then I redrape the skin. So it can be used in a varying amount of patients, and it allows for a really nice result. I just thought that over the years, the results were good, but they weren't as natural as I would have liked them. So that's how I got to the High SMAS Deep Plane combo operation, I guess I'd call it. So stay tuned, let's talk more about that. So this slide is of what we call the superficial fat compartments. Those are the fat compartments that are sitting under the skin when you lift up the skin. And if you notice the ligaments, the little white structures, they're fairly broad and well organized all the way around the face in multiple areas. You have to release those areas, otherwise you can't redrape the skin as nicely as you want to in traditional wide undermining skin operations. So if you don't do that, you can get funny little skin irregularities, especially the older you become and the more attenuated or weakened and aged those skin connections become. So let's look at the next layer underneath that, and we can talk about how that's important for my decision to move into high SMAS deep plane surgery. Now in this slide, we are in the what we call sub-SMAS plane, and this is the plane that those of us that do deep surgery or sub-SMAS surgery want to get into cleanly. You see a little diaphanous cover over those facial nerves, and those facial nerves are what power the muscles to our face. We clearly don't want to injure them. So what we want to do is we want to get over these various planes to get into the deep plane. So when I make my incision, this part here is what we call the fixed SMAS. It's much more connected to the deep tissues, but it is a more superficial area and a bit farther away in terms of depth from the facial nerves. As you can see, the trunk branches out like that. And so when I get in that space, I get a good start before I actually get into the more dangerous part of the deep plane. So when you get in front of the masseter muscle, this area is called the mobile SMAS. And so when you get past this area, you're getting into the area of the osteocutaneous ligaments, and that's where you have to be really careful to bring those osteocutaneous ligaments down, staying above that plane where the facial nerve branches come out. And so once you can get past the osteocutaneous ligaments, you're now in what we call the extended deep plane. If you come into the midface, come out to the nasolabial folds, and come out past the mandibular ligament. And so it's very important to understand that facial nerve anatomy, and I think that's the mark of the surgeon who's best able to provide deep plane facelift procedures in a safe manner, is an absolutely thorough understanding of the anatomy in those deep spaces. Now, I go and perform cadaveric dissections in facelift courses fairly often. In fact, I've got 2 rounds of courses coming up in 2024 so that I can keep my skill set at peak level. So it's important that you understand that when you can get into that deep space, you are essentially lifting the skin as one unit in a much more natural way, because you're not having to disconnect all those little surface connections to get smoothness. You're taking the whole thing as a block and lifting it up. And it's just a matter of whether you come in the traditional deep plane cutting point, which I'll show you in a minute, or you're coming in the high SMAS plane, which I like better. So let's check out this next slide. So I like this slide. It basically is a really good graphic to understand the difference between a traditional low SMAS entry point, a traditional high SMAS entry point, and then for comparison, I drew in red the traditional deep plane entry point. Those little black X's are my representation of the osteocutaneous ligament, so you can see where we have to get to break through them so we can get really nice mobility of the face in a natural way and get things redraped really beautifully. So when you look at that top panel, you see really the low SMAS entry point. It's a safer entry point in many ways, but it's only good for raising the jowls, and you can get into the neck a little bit. And so you kind of get this sort of lift. When you go into the high SMAS entry point, because of the higher level and more medial dissection towards the base of the eye, you're actually able to get tightening at the jowls, tightening at the corner of the mouth with lift, and I'll show you some before and afters with that. And you can actually get mid-face lift and sort of lifting and support to the base of the eye. In some cases, reducing the necessity for lower eyelid surgery and rejuvenation. We had a great talk recently with Dr. Dominic Bray out of London, and he showed how you can avoid eyelid surgery in some patients. And so I've seen that in my own practice, but he will be publishing a paper on that, hopefully here in the near future. So when you see the deep plane entry point, you're coming a lot farther forward. You're coming much closer to sort of that danger zone that people talk about. But a good surgeon can get into the deep plane that way and get down past the ligaments and lift up those same spaces. And so whether you go high SMAS or deep plane in terms of the surgeon you choose, just remember they should have done a lot of these cases and understand the anatomy and the mechanics of why they do it. Now, my background, like I said, is in biomedical engineering, so I kind of understand the mechanics better than most people because I've spent 30 years looking at mechanics in facial surgery. So I like the high SMAS because it allows me sort of a prep runway before I get into the deep and more dangerous areas, so I can really get in there. And I like it because it allows me to reposition faces in a much broader range of ages. So let's check this next slide out. Here is a high SMAS facelift. This is the zygomatic arch. I've made my cut here. I've made a cut here 1 centimeter in front of the preauricular incision. And I've dissected to the front end of the masseter muscle. You can see how much I can pull. Let's take a look and see how much pulling I can get in her neck. And I'm not going to be opening her neck. I'm just going to be using this flap to tighten her face. So this is a high SMAS facelift. I'm going to cut off all this extra and reattach it right here where you see that line.
That's cool.
So who is a good candidate for facelift surgery anyways? Well, in my practice, I've operated on patients as young as 25 years old and as old as 95 years old. Now, those young patients, the reasons they're coming in for facelift surgery is not because they've got a bunch of hanging skin and neck bands, etc. They are usually very square-faced and want to see more of that V shape. So as V-shaping surgery has gotten popular over the last several years, young patients come in wanting that particular aesthetic. Now, for I would say the more normal group of facelift patients, that's pretty much a group of men and women between their mid 40s and mid to late 60s. And they show an evidence of volume loss and facial laxity that can no longer be managed by non-surgical treatments like filler and laser and microneedling and chemical peels and that sort of thing. They need large shifts of tissue that only surgery can provide. Now, of course, you have to have very realistic expectations about what facelifts can and cannot do for you. If you have a significant amount of bone loss, if you've lost a tremendous amount of weight, and you're showing sort of gaunt features in your face, a facelift is going to tighten up some of the loose skin, but then you need to think about adding volume back to the face, and oftentimes you need to add skin tightening modalities like laser to get a better, more natural outcome. And then finally, a good candidate for facelift surgery knows that they need to give themselves enough downtime to allow for proper healing before they return to normal social activities. This way, they can heal, avoid excess stress on their tissues, and reduces the chances of early complications. Now, facial aging in and of itself is not a spot aging phenomenon. You age in a global manner, and certain areas will age more than others. Certain areas will stay younger longer. So when we analyze faces, we take a look at the whole face. That doesn't necessarily mean, however, that patients want to change everything. However, when people are looking for more global improvements, some ancillary procedures that we offer to optimize facelift outcomes involve brow lifting, and that's basically a procedure in which we raise the eyebrow position to open up the eyes, take a lot of heaviness off of the lower forehead, and just give them more brightness. Now, some patients need neck surgery as well, and neck surgery can be done in a number of ways depending on how much aging has occurred. If you're young, you may only need the platysma muscles, which are those split muscles in the center of the neck, repaired, and that's called a platysmoplasty. Some patients need a neck lift operation in which we also repair the platysma and we redrape skin from behind the ears, and that would be considered a regular neck lift. Finally, some patients, because of excess fullness of tissues in the neck, need deep structures in the neck reduced in size and volume, and that's called deep neck lifting. Now, patients that are overweight can have excess fat in their necks, and of course they could use things like neck liposuction. And when people have mid-face volume issues, they might need a mid-face lift. They may need cheek implants. If they've got excess upper eyelid skin, an upper eyelid lift would be helpful. If they've got bulging of the lower eyelids or malposition of the lower eyelid fat pads, then a lower eyelid lift might be necessary. If they've got a small chin, and patients that have needed braces typically have underdeveloped jaw lines, and so they might need a chin implant to bring that forward. If the skin's seen a lot of sun damage and environmental damage, then things like lasers and chemical peels might be helpful for polishing the skin. And then finally, for people who don't want to put in silicone facial implants, but want to revolumize their face, then they can think about things like facial fat transfer. And if they don't have enough fat on their bodies, then we can use things like biologic revolumizers like Sculptra and Radiesse. So these are some options to optimize the face when just a facelift alone isn't enough. Now, surgery does carry risks, and I've put a small list here of the basic, more common risks that a facelift surgery patient might encounter. Now, in general, facelift surgery is extraordinarily safe, and good facelift surgeons make it that way on purpose. But some things that can happen would be things like bleeding, infection, scarring, wound healing problems, hair loss, contour irregularities, numbness of the skin, a facial nerve injury with facial muscle weakness or paralysis, prolonged skin discoloration like excess redness or hyperpigmentation or hypopigmentation, and need for revision surgery. All patients need to factor in the appropriate downtime so they can do the right postoperative care and get the best outcomes possible. And they should also recognize that while things may look perfect on day 0 when you've had your surgery, as time goes on and the healing process takes over, sometimes outcomes are suboptimal and you need to factor in both downtime and financially for the possibility of revision surgery down the line. So beware. So some recovery considerations for patients planning to undergo facelift surgery. In my practice, a deep plane face and neck lift takes roughly 2 to 3 hours to perform, and 99% of my patients opt for oral sedation with local anesthetic. Now, of course, if you're squeamish, we are happy to take you to the surgery center for general anesthesia management. For the first week, your head's going to be elevated. You're going to be using compression and icing. You're allowed to go out for gentle walks, but nothing that basically increases your heart rate. After the first week, your stitches come out. Now, 2 weeks later, you get to start cardio. At 4 weeks post-op, you get to start weight training. Now, be careful. At this point, we have patients get back to most activities, but we want them to be careful that they're not tensing their head and neck area so that those scars are still being relatively left alone. At about 6 months, your incisions are fully mature and all the deep tissues have pretty much healed up. At about a year, your sensory nerves have fully recovered and most patients have complete recovery of sensation. Most patients can expect that their High SMAS Deep Plane facelift will last them about 10 to 15 years, but that depends on how well they take care of the initial product. Now, those who get the best results are those who are non-smokers, younger patients, of course, because they've got better tissues to work with in the first place, those who use medical grade skincare and sunblock, and of course those who maintain stable body weight so that there's not undue stretch and relaxation on the facial tissues. So this patient didn't care about her asymmetric eyebrows, didn't care about the puffy lower eyelid fat pads, and didn't really care about her sun damage. All she wanted was repair of those neck bands, a little tighter of a neck, and some improvements to the jawline. And basically, she had a lower face and neck lift with platysmoplasty, using incisions both in front of the ear, behind the ear, and under the chin. And these are her results. So she looks refreshed, she looks youthful, and more importantly, she's happy. Now, this patient wanted a little bit more. She really didn't like her neck or her jawline, and she really didn't like the sun damage that she presented with. So she actually had a lower face and neck lift with platysmoplasty, and she ended up having full face laser resurfacing, and you can see a significant improvement in her skin. You can see a beautiful shadow line on the after photos on frontal view, just showing that the neck has been lifted. There's no laxity in the space. She's got a beautiful angle on profile view, and she just looks younger, refreshed, and very vibrant. This lovely lady had a short scar facelift with neck muscle repair, and you can see that the parentheses deformity around her mouth has been cured. She doesn't show any jowl laxity, and even her midface has been lifted and repositioned to support some of that basic lower lid hollowing that she presented with. So she looks great, looks youthful, well put together, and definitely shows a better surface area to volume ratio on her face like I talked about earlier. Now this gentleman felt like his neck was a little hanging, and he felt like he had extra eyelid skin on the upper eyelids. And so what I did for him again was a short scar, vertical deep plane facelift with liposuction of the neck and platysmal muscle repair, and I also did a skin-only upper blepharoplasty. And you can see he just looks more refreshed. His face is more verticalized, and it looks more proportional. So I think it's a great outcome on him. So in this lady, she had a lower face and neck lift with neck liposuction and platysmal muscle repair. And you can see I've restored her cervical mental angle. That initial break that you see near her right jowl to her chin has been smoothed out and given continuity, and her earlobes look the same as they did pre-op. So this is a very good result, and she looks lovely. So this lovely lady, who is almost 70 years old, had lower eyelid surgery with laser, and then she had a High SMAS Deep Plane lower face and neck lift with neck liposuction and platysmoplasty, and you can see an absolutely significant improvement in her face. She has no hanging neck, and she looks lovely in photos and is very happy with her results. So interestingly enough, even though she didn't opt for a brow lift, you can see that the tail of her eyebrows has been lifted a little bit because of the direction of skin shift on the side of the face. So it looks great on her. Now this patient underwent upper eyelid blepharoplasty, lower eyelid blepharoplasty with laser, and a lower face and neck lift, again using a High SMAS Deep Plane technique along with neck liposuction and platysmoplasty. And you can see she goes from this sort of sad, down in the mouth appearance to this lovely, bright, approachable aesthetic. So she's very happy with the outcome, and I can't be happier for her. Now this patient underwent High SMAS Deep Plane facelifting surgery with platysmoplasty. She also had lower eyelid secondary surgery with laser resurfacing, and she had temporal brow lifting. The cool thing about her is she had a facelift a while ago, and so this was a secondary facelift, and her deep plane was just as easy to get into as I can imagine it was the first time for her original surgeon. But what's cool is she's 81 years old, and she healed beautifully and looks fantastic, and it shows you that you're never too old as long as you're a healthy patient for a facelift. Thanks for watching, and if you have any more questions about High SMAS Deep Plane facelift surgery, this is how I can be reached.